That is our top story this evening. Thanks so much for joining us. I'm Jane Aldrich.
And I'm Greg Adeline. Doctors and nurses are normally on the same side of medical issues that come up in politics. But a bill making its way through the Michigan Senate would allow advanced nurses to essentially treat patients without having a doctor or physician supervising them.
And as Joe Khalil reports, this issue has now sparked a big debate between nurses and doctors and has both sides asking who's qualified to do what.
With the Affordable Care Act and a statewide Medicaid expansion set to kick in next year, medical experts expect to see more patients seeking care.
These patients are going to have nowhere to go because it's going to be hard for them to get in to see anyone.
That's why Deborah Nault with the State Nurses Association says she supports Senate Bill 2, which would allow advanced nurses to treat patients without supervision from a doctor or physician, something Nault says those nurses are qualified to do.
All that they are doing is what they've already been educated and certified to do.
The Nurses Association says the bill doesn't give any new authority to nurses that they didn't already have, but the state's medical society says even advanced nurses aren't qualified to do the work that doctors do.
I don't think it's fair to Michigan's patients.
But Dr. Kenneth Almacian says nurses shouldn't treat, diagnose, or write prescriptions without a doctor, something the bill would allow.
It would allow them to practice medicine with a nursing education.
Almacian says creating a two-tier system where some have access to doctors and others to nurse practitioners isn't a solution to a growing volume of patients.
The way not to do that is to put them into a position of being physician substitutes.
In Lansing, Joe Khalil, 6 News.